There are several types of symptoms that are very common in these patients. One of the most common symptoms is pain. And with these types of tumors, that's usually a neuropathic type of pain, which means it's nerve related, often burning, that kind of thing. And this is because the parent nerve where the tumor is growing is being stretched, bent, irritated, and damaged by the growing tumor. And so medications that are used for that are also used for other types of neuropathic pain, and those include Tegretol, gabapentin, Elavil, and Lyrica. And any combination of those drugs, or even using them by themselves to start with, is often helpful in controlling or at least minimizing the neuropathic pain from a plexiform tumor. In terms of NF plexiform tumor-related weakness and motor symptoms, again, this can be very common depending on which nerves the tumor is growing from, especially if it's in the brachial plexus, on some of the motor nerve roots along the lower spine or in the lumbosacral plexus. And we can't really just fix this weakness per se. We really have to have the patient focus on physical therapy and occupational therapy and work on their strength, gait, balance, coordination, and fine motor skills to improve their baseline function. And again, some types of braces may be helpful in terms of bracing their wrists and their ankles and those kinds of things, and the therapist will guide the physician on what types of braces the patient needs. In terms of psychosocial issues, as mentioned above, these are really common in this patient population, and many things can be seen, including depression, anxiety, isolation, loneliness, difficulty finding work. Often they have limited finances, and they have feelings of inadequacy and inferiority. We have many of our patients see a counselor or a psychologist. Sometimes our social worker will work with them and do sessions in the clinic. And even a psychiatrist can be helpful if the patient has severe disease that may need some medication.